1. What is the primary function of insulin in the body? A. Helps in regulating blood pressure. B. Helps regulate blood glucose levels. C. Increases the breakdown of fat for energy. D. Helps in immune system defense. Answer. B. Helps regulate blood glucose levels. Rationale. Insulin's primary function is to facilitate the uptake of glucose into cells for energy production, which helps to regulate blood glucose levels. Option A, regulating blood pressure, is unrelated to insulin's function. Option C, increasing fat breakdown, is more related to glucagon. Option D, immune defense, is incorrect because insulin does not directly influence the immune system. 2. Which of the following is the most common cause of type 2 diabetes? A. Genetic mutations causing insulin resistance. B. Increased insulin production due to pancreatic failure. C. Insulin resistance and obesity. D. Autoimmune destruction of pancreatic beta cells. Answer. C. Insulin resistance and obesity. Rationale. Type 2 diabetes is primarily caused by insulin resistance and often associated with obesity. Option A is incorrect because genetic mutations are not the main cause of type 2 diabetes. Option B refers more to type 1 diabetes, where the pancreas fails to produce insulin. Option D is characteristic of type 1 diabetes, not type 2. 3. Which diagnostic test is used to assess long-term blood glucose control in diabetic patients? A. Random blood glucose test. B. Fasting blood glucose test. C. Hemoglobin A1C, HbA1c test. D. Oral glucose tolerance test, OGTT. Answer. C. Hemoglobin A1C, HbA1c test. Rationale. The hemoglobin A1c test provides an indication of the average blood glucose levels over the past 2 to 3 months, which is essential for assessing long-term control. Option A. Random blood glucose. Measures glucose at a single point in time. Option B. Fasting glucose. Provides a snapshot of glucose levels after fasting but doesn't assess long-term control. Option D. OGTT. Is typically used for diagnosing gestational diabetes. 4. Which complication is most commonly associated with poorly controlled type 1 diabetes? A. Diabetic retinopathy. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Hypertension. Answer. B. Diabetic ketoacidosis, DKA. Rationale. Diabetic ketoacidosis, DKA, is a serious complication that is more commonly associated with poorly controlled type 1 diabetes. It occurs when insulin levels are insufficient, causing the body to break down fat for energy and leading to the accumulation of ketones. Diabetic retinopathy, A, is a chronic complication. HHS-C is more common in type 2 diabetes. Hypertension, D, can occur with diabetes, but is not a direct complication of poor glucose control. 5. Which of the following medications is commonly used to treat type 2 diabetes by increasing insulin sensitivity? A. Metformin. B. Glympuride. C. Insulin. D. Glucagon. Answer. A. Metformin. Rationale. Metformin is a first-line medication for type 2 diabetes that works by increasing insulin sensitivity and reducing hepatic glucose production. Glympuride, B, is a sulfonylurea that increases insulin secretion, not sensitivity. Insulin, C, is typically used in type 1 diabetes and advanced type 2 cases. Glucagon, D, raises blood glucose levels and is used in hypoglycemic emergencies, not in routine diabetes treatment. 6. What is the primary difference between type 1 and type 2 diabetes in terms of pathophysiology? A. Type 1 diabetes is characterized by insulin resistance, while type 2 involves autoimmune destruction of pancreatic beta cells. B. Type 1 diabetes involves autoimmune destruction of pancreatic beta cells, while type 2 involves insulin resistance. C. Type 1 diabetes is caused by obesity, while type 2 is not. D. Type 1 diabetes is preventable through diet, while type 2 is not. Answer. B. Type 1 diabetes involves autoimmune destruction of pancreatic beta cells, while type 2 involves insulin resistance. Rationale. Type 1 diabetes results from an autoimmune response that destroys pancreatic beta cells, leading to a lack of insulin production. Type 2 diabetes involves insulin resistance, where the body becomes less responsive to insulin. Option A incorrectly reverses the pathophysiology of both types. Option C is incorrect because obesity is more closely linked to type 2 diabetes. Option D is incorrect as both types of diabetes can be influenced by lifestyle choices, though type 1 is not preventable. 7. A 35-year-old pregnant woman is diagnosed with gestational diabetes. Which of the following is the primary risk for this condition? A. Obesity.
B. Smoking.
C. Genetic predisposition. D. Insulin resistance during pregnancy. Answer: D. Insulin resistance during pregnancy. Rationale: gestational diabetes occurs primarily due to insulin resistance during pregnancy. The body requires more insulin, but the pancreas may not be able to produce enough to meet the demand, leading to high blood sugar. Obesity, A. Smoking, B. And genetic predisposition, C. can increase the risk, but insulin resistance, D. is the most direct cause. 8. What is the main clinical manifestation of diabetic retinopathy? A. Decreased visual acuity. B. Unilateral loss of vision. C. Sudden onset of blurry vision in one eye. D. Redness and irritation in both eyes. Answer: A. Decreased visual acuity. Rationale: diabetic retinopathy is the leading cause of vision loss in people with diabetes and typically causes decreased visual acuity over time. It is not usually present as sudden loss of vision, B, or blurry vision in one eye, C. Redness and irritation, D, are more commonly seen in eye infections, not retinopathy. 9. Which of the following statements is true about diabetic foot care? A. Feet should be washed in hot water to improve circulation. B. It is important to inspect the feet daily for cuts or sores. C. Feet should be massaged regularly to prevent neuropathy. D. Shoes should be worn without socks to prevent moisture buildup. Answer: B. It is important to inspect the feet daily for cuts or sores. Rationale: daily foot inspection is essential for diabetic patients to detect cuts, sores, or signs of infection early, preventing complications. Washing feet in hot water, A, can cause burns due to reduced sensation. Massaging, C, can cause injury in neuropathic patients. Shoes should always be worn with socks, D, to prevent friction and moisture buildup. 10. Which of the following is the most common acute complication of type 2 diabetes? A. Hypoglycemia. B. Hyperosmolar hyperglycemic state, HHS. C. Diabetic ketoacidosis, DKA. D. Severe dehydration due to insulin resistance. Answer: B. Hyperosmolar hyperglycemic state, HHS. Rationale: hyperosmolar hyperglycemic state, HHS, is an acute complication more commonly associated with type 2 diabetes, characterized by extremely high blood glucose levels and dehydration without significant ketosis. Hypoglycemia, A, can occur but is more common with insulin therapy. DKA-C is more characteristic of type 1 diabetes. Severe dehydration, D, is a feature of HHS but not the main acute complication. 11. What is a common sign of diabetic nephropathy? A. Shortness of breath. B. Proteinuria. C. High fever. D. Weight loss. Answer: B. Proteinuria. Rationale: proteinuria, or the presence of excess protein in the urine, is a hallmark of diabetic nephropathy, a complication of diabetes affecting the kidneys. Shortness of breath, A, may be a symptom of heart failure. High fever, C, and weight loss, D, are not typical signs of nephropathy. 12. What is the primary role of glucagon in the body? A. Increases glucose production by the liver. B. Decreases glucose production by the liver. C. Stimulates insulin release from the pancreas. D. Lowers blood sugar levels by promoting glucose uptake. Answer: A. Increases glucose production by the liver. Rationale: glucagon raises blood glucose levels by stimulating the liver to release stored glucose, glycogen. It does not promote insulin release, C, or lower blood sugar, D. Option B is incorrect as glucagon increases glucose production. 13. A patient with diabetes is at risk for which of the following infections due to poor blood flow? A. Upper respiratory infections. B. Urinary tract infections. C. Respiratory syncytial virus, RSV. D. Fungal infections of the skin. Answer: B. Urinary tract infections. Rationale: people with diabetes are at increased risk for urinary tract infections due to poor circulation, which can impair immune function and allow bacteria to grow. Upper respiratory infections, A, are more common in individuals with compromised immunity, but are not directly linked to diabetes. Respiratory syncytial virus, RSV, C, and fungal skin infections, D, are less common in diabetes. 14. Which of the following should be monitored in a patient receiving insulin therapy? A. Blood pressure. B. Serum potassium levels. C. Hemoglobin levels. D. Liver function tests. Answer: B. Serum potassium levels. Rationale: insulin therapy can cause hypokalemia, low potassium levels, as insulin promotes the uptake of potassium into cells. Monitoring serum potassium is essential to prevent dangerous complications. Blood pressure, A, is important but not a direct concern with insulin. Hemoglobin, C, and liver function, D, are not directly affected by insulin therapy. 15. What is the first-line pharmacologic treatment for type 2 diabetes? A. Insulin. B. Metformin. C. Sulfonylureas. D. GLP-1 receptor agonists. Answer: B. Metformin. Rationale: metformin is the first-line treatment for type 2 diabetes due to its ability to increase insulin sensitivity and decrease liver glucose production. Insulin, A, is typically used when oral medications are insufficient. Sulfonylureas, C, and GLP-1 receptor agonists, D, may be used if metformin is not effective. 16. What is the primary cause of insulin resistance in type 2 diabetes? A. Insulin deficiency. B. Increased muscle sensitivity to insulin. C. Obesity and excess fat accumulation. D. Lack of insulin secretion from the pancreas. Answer: C. Obesity and excess fat accumulation. Rationale: insulin resistance in type 2 diabetes is primarily caused by obesity and excess fat accumulation, which impair the body's ability to respond to insulin. Option A, insulin deficiency, is more characteristic of type 1 diabetes. Increased muscle sensitivity, B, would reduce insulin resistance, not cause it. Option D refers to the cause of type 1 diabetes, not type 2. 17. Which of the following conditions is most often associated with diabetes-induced neuropathy? A. Peripheral vascular disease. B. Stroke. C. Diabetic foot ulcers. D. Asthma. Answer: C. Diabetic foot ulcers. Rationale: diabetic neuropathy often leads to diabetic foot ulcers due to nerve damage that impairs sensation, making the feet more vulnerable to injury. Peripheral vascular disease, A, can occur with diabetes, but is not the most common condition associated with neuropathy. Stroke, B, and asthma, D, are unrelated to diabetic neuropathy. 18. A patient with type 1 diabetes is at high risk for which acute complication? A. Hyperosmolar hyperglycemic state, HHS. B. Diabetic ketoacidosis, DKA. C. Hypoglycemia. D. Diabetic nephropathy. Answer: B. Diabetic ketoacidosis, DKA. Rationale: diabetic ketoacidosis, DKA, is a potentially life-threatening condition more common in type 1 diabetes. It occurs when insulin levels are too low, leading to the breakdown of fat for energy and the accumulation of ketones. Hyperosmolar hyperglycemic state, A, is more common in type 2 diabetes. Hypoglycemia, C, can occur, but is not as dangerous as DKA. Diabetic nephropathy, D, is a long-term complication, not an acute one. 19. Which of the following is a key prevention strategy for type 2 diabetes? A. Reducing carbohydrate intake. B. Regular physical activity. C. Taking insulin as prescribed. D. Avoiding all fruits and vegetables. Answer: B. Regular physical activity. Rationale: Regular physical activity is a key prevention strategy for type 2 diabetes as it helps improve insulin sensitivity and control blood sugar. Reducing carbohydrate intake, A, is not as critical for prevention. Insulin, C, is used for managing diabetes, not prevention. Avoiding fruits and vegetables, D, is incorrect as they provide important nutrients and fiber for overall health. 20. A patient with diabetes is taught how to manage blood glucose levels. Which of the following is important for self-management? A. Monitor blood glucose only during illness. B. Avoid insulin injections after meals. C. Keep a record of blood glucose levels. D. Only monitor blood glucose when feeling symptomatic. Answer: C. Keep a record of blood glucose levels. Rationale: keeping a record of blood glucose levels is crucial for self-management and allows adjustments to treatment as needed. Monitoring only during illness, A, or when symptomatic, D, is insufficient. Insulin should be taken as prescribed, including after meals if necessary, B. 21. Which type of diabetes is most commonly diagnosed in childhood? A. Type 1 diabetes. B. Type 2 diabetes. C. Gestational diabetes. D. Monogenic diabetes. Answer: A. Type 1 diabetes. Rationale: type 1 diabetes is most commonly diagnosed in childhood due to autoimmune destruction of pancreatic beta cells. Type 2 diabetes, B, is becoming more common in children but is still more prevalent in adults. Gestational diabetes, C, occurs during pregnancy. Monogenic diabetes, D, is rare and typically diagnosed in younger adults. 22. What is a common long-term complication of poorly controlled diabetes? A. Cataracts. B. Diabetic retinopathy. C. Appendicitis. D. Acute sinusitis. Answer: B. Diabetic retinopathy. Rationale: diabetic retinopathy is a common long-term complication of poorly controlled diabetes due to damage to the blood vessels in the retina. Cataracts, A, can also occur but are less common than retinopathy. Appendicitis, C, and acute sinusitis, D, are unrelated to diabetes. 23. Which lab test is commonly used to assess the control of blood sugar over the previous 3 months? A. Random blood glucose test. B. Hemoglobin A1C, HbA1c. C. Fasting blood glucose test. D. Oral glucose tolerance test, OGTT. Answer: B. Hemoglobin A1C, HbA1c. Rationale: the hemoglobin A1c test reflects the average blood glucose level over the past 2 to 3 months, making it a key indicator of long-term control. Random blood glucose, A, fasting glucose, C, and OGTT, D, are used for diagnosing or monitoring diabetes, but they do not provide long-term control information. 24. Which dietary modification is most important for someone with type 2 diabetes? A. Increasing carbohydrate intake. B. Reducing refined carbohydrates and sugars. C. Eliminating all fats from the diet. D. Avoiding all protein sources. Answer: B. Reducing refined carbohydrates and sugars. Rationale: reducing refined carbohydrates and sugars helps manage blood glucose levels in type 2 diabetes. Increasing carbs, A, would raise blood glucose levels. Eliminating fats, C, is not recommended, as healthy fats are part of a balanced diet. Protein sources, D, are important for nutrition and should not be avoided unless specific dietary restrictions are needed. 25. A 30-year-old woman with type 1 diabetes is planning to become pregnant. What is the first step in her pre-pregnancy care? A. Begin insulin therapy. B. Achieve optimal blood glucose control. C. Increase caloric intake. D. Discontinue all medications. Answer: B. Achieve optimal blood glucose control. Rationale: achieving optimal blood glucose control before pregnancy is essential for reducing the risk of complications such as miscarriage, preterm birth, and birth defects. Insulin therapy, A, may be necessary but should already be in place. Increasing caloric intake, C, and discontinuing medications, D, are not appropriate before pregnancy. 26. Which of the following is a common sign of hypoglycemia in a diabetic patient? A. Increased thirst. B. Shakiness and sweating. C. Abdominal pain. D. Weight gain. Answer: B. Shakiness and sweating. Rationale: hypoglycemia, low blood sugar, often causes symptoms such as shakiness, sweating, and irritability. Increased thirst, A, is more common in hyperglycemia. Abdominal pain, C, and weight gain, D, are not typically signs of hypoglycemia. 27. What is the primary action of sulfonylureas in the treatment of type 2 diabetes? A. Decrease insulin sensitivity. B. Increase insulin secretion from the pancreas. C. Slow gastric emptying. D. Prevent glucose absorption in the intestine. Answer: B. Increase insulin secretion from the pancreas. Rationale: sulfonylureas stimulate the pancreas to release more insulin, which helps lower blood glucose levels. They do not affect insulin sensitivity, A, or gastric emptying, C. They also do not prevent glucose absorption in the intestine, D, which is the action of other medications like alpha-glucosidase inhibitors. 28. Which of the following is a common complication of uncontrolled type 2 diabetes? A. Diabetic ketoacidosis, DKA. B. Stroke. C. Diabetic retinopathy. D. Addison's disease. Answer: C. Diabetic retinopathy. Rationale: diabetic retinopathy is a common complication of uncontrolled diabetes and can lead to blindness if untreated. Diabetic ketoacidosis, A, is more common in type 1 diabetes. Stroke, B, can be related to diabetes but is not as directly linked as retinopathy. Addison's disease, D, is unrelated to diabetes. 29. When should a diabetic patient check their blood glucose levels? A. Only when feeling unwell. B. Before meals and at bedtime. C. Once a week. D. Only after exercise. Answer: B. Before meals and at bedtime. Rationale: blood glucose should be checked before meals and at bedtime to monitor how food and activity affect glucose levels. Checking only when unwell, A, or once a week, C, is insufficient. Checking only after exercise, D, does not provide a comprehensive view of blood glucose control. 30. What is the primary purpose of insulin therapy in diabetes management? A. To cure diabetes. B. To lower blood glucose levels. C. To prevent dehydration. D. To increase appetite. Answer: B. To lower blood glucose levels. Rationale: insulin therapy is primarily used to help lower blood glucose levels in individuals with diabetes, especially those with type 1 diabetes. It does not cure diabetes, A, prevent dehydration, C, or increase appetite, D. 31. Which of the following is a major symptom of hypoglycemia, low blood sugar? A. Increased thirst. B. Trembling or shakiness. C. Excessive urination. D. Blurry vision. Answer: B. Trembling or shakiness. Rationale: hypoglycemia typically causes symptoms like trembling or shakiness due to the body's reaction to low glucose levels. Increased thirst and excessive urination are more common with hyperglycemia. 32. What is the main function of glucagon in the body? A. Stimulate insulin release. B. Raise blood glucose levels. C. Reduce blood pressure. D. Inhibit glycogen breakdown. Answer: B. Raise blood glucose levels. Rationale: glucagon primarily raises blood glucose levels by stimulating the liver to release glucose. It does not stimulate insulin release or reduce blood pressure. 33. What is the most common type of diabetes diagnosed in children? A. Type 1 diabetes. B. Type 2 diabetes. C. Gestational diabetes. D. Latent autoimmune diabetes in adults, LADA. Answer: A. Type 1 diabetes. Rationale: type 1 diabetes is the most common form of diabetes diagnosed in children. Type 2 diabetes is more common in adults, while gestational diabetes occurs during pregnancy. 34. Which of the following complications is commonly associated with uncontrolled diabetes? A. Retinopathy. B. Asthma. C. Cataracts. D. diabetic neuropathy. Answer: A. Retinopathy. Rationale: diabetic retinopathy is a common complication of uncontrolled diabetes, which can lead to blindness. Asthma, B, and cataracts, C, are not directly related to diabetes. 35. What is the first-line treatment for type 2 diabetes? A. Insulin therapy. B. Metformin. C. SGLT2 inhibitors. D. Glucagon-like peptide 1 agonists. Answer: B. Metformin. Rationale: metformin is the first-line treatment for type 2 diabetes as it improves insulin sensitivity and reduces glucose production in the liver. Insulin is typically used later, if needed. 36. Which of the following is a sign of diabetic ketoacidosis, DKA? A. Rapid, deep breathing. B. Bradycardia. C. Increased salivation. D. Nausea and vomiting. Answer: A. Rapid, deep breathing. Rationale: rapid, deep breathing, Kussmaul respirations, is a hallmark sign of DKA, which occurs when the body tries to expel excess acid. Bradycardia and increased salivation are not typical DKA symptoms. 37. What test is commonly used to diagnose diabetes? A. Blood urea nitrogen, BUN. B. Hemoglobin A1C, HbA1c. C. Liver function tests, LFTs. D. Serum creatinine. Answer: B. Hemoglobin A1C, HbA1c. Rationale: the hemoglobin A1c test is commonly used to diagnose diabetes, as it measures the average blood glucose level over the past 2 to 3 months. The other tests are not specific for diabetes diagnosis. 38. A patient with diabetes reports blurred vision. Which of the following is a possible cause? A. Diabetic neuropathy. B. Diabetic retinopathy. C. Hypoglycemia. D. Hyperthyroidism. Answer: B. Diabetic retinopathy. Rationale: blurred vision can be caused by diabetic retinopathy, which affects the blood vessels in the retina due to high blood glucose levels. Diabetic neuropathy affects the nerves, not the eyes. 39. Which of the following is a common long-term complication of poorly controlled diabetes? A. Peripheral arterial disease. B. Chronic fatigue syndrome. C. Preeclampsia. D. Hypothyroidism. Answer: A. Peripheral arterial disease. Rationale: poorly controlled diabetes can lead to peripheral arterial disease, PAD, due to damage to blood vessels, increasing the risk of foot ulcers and amputation. Chronic fatigue syndrome is not directly caused by diabetes. 40. In patients with type 1 diabetes, what is the purpose of insulin therapy? A. To increase blood glucose levels. B. To enhance protein synthesis. C. To replace the insulin that the pancreas no longer produces. D. To promote weight gain. Answer: C. To replace the insulin that the pancreas no longer produces. Rationale: in type 1 diabetes, the pancreas produces little to no insulin, so insulin therapy is required to replace this essential hormone for glucose regulation. The other options are not correct. 41. Which of the following is a typical feature of type 2 diabetes? A. Insulin resistance. B. Complete insulin deficiency. C. Autoimmune destruction of beta cells. D. Extreme weight loss. Answer: A. Insulin resistance. Rationale: in type 2 diabetes, the body becomes resistant to insulin, leading to elevated blood glucose levels. Complete insulin deficiency is more characteristic of type 1 diabetes. 42. Which of the following is the recommended initial management for a diabetic foot ulcer? A. Amputation. B. Topical antibiotics. C. Clean and debride the wound. D. Oral corticosteroids. Answer: C. Clean and debride the wound. Rationale: diabetic foot ulcers should be cleaned and debrided to remove dead tissue and prevent infection. Topical antibiotics may be used later if infection is present. 43. What is a major risk factor for the development of type 2 diabetes? A. High-fiber diet. B. Obesity. C. Excessive physical activity. D. Low-protein diet. Answer: B. Obesity. Rationale: Obesity is a major risk factor for type 2 diabetes as it leads to insulin resistance. High-fiber and low-protein diets are not major risk factors for type 2 diabetes. 44. Which of the following would be a contraindication for the use of metformin? A. Chronic kidney disease. B. Hypertension. C. Hyperlipidemia. D. Asthma. Answer: A. Chronic kidney disease. Rationale: metformin is contraindicated in patients with chronic kidney disease due to the risk of lactic acidosis. It is generally safe for those with hypertension and hyperlipidemia. 45. What is a key sign of hyperosmolar hyperglycemic state, HHS? A. Hyperventilation. B. Severe dehydration. C. Deep, labored breathing. D. Hypothermia. Answer: B. Severe dehydration. Rationale: HHS is characterized by severe dehydration due to the high glucose levels, which cause fluid loss. Hyperventilation and deep breathing are more indicative of diabetic ketoacidosis, DKA. 46. Which of the following is the primary cause of type 1 diabetes? A. Insulin resistance. B. Autoimmune destruction of beta cells. C. Obesity. D. Sedentary lifestyle. Answer: B. Autoimmune destruction of beta cells. Rationale: type 1 diabetes is caused by an autoimmune response that destroys the insulin-producing beta cells in the pancreas. The other options are more relevant to type 2 diabetes. 47. Which of the following is a common side effect of insulin therapy? A. Hyperglycemia. B. Hypoglycemia. C. Hyperthyroidism. D. Diarrhea. Answer: B. Hypoglycemia. Rationale: insulin therapy can lead to hypoglycemia if too much insulin is administered or if meals are skipped. Hyperglycemia is more likely in poorly controlled diabetes, not from insulin therapy. 48. What is the primary mechanism of action of sulfonylureas in treating type 2 diabetes? A. Increase insulin production from the pancreas. B. Improve insulin sensitivity in tissues. C. Inhibit glucose absorption in the intestines. D. Decrease hepatic glucose production. Answer: A. Increase insulin production from the pancreas. Rationale: sulfonylureas stimulate the pancreas to release more insulin. They do not improve insulin sensitivity or inhibit glucose absorption. 49. Which of the following is a common long-term complication of type 1 diabetes? A. Diabetic neuropathy. B. Hypertension. C. Asthma. D. Chronic kidney disease. Answer: A. Diabetic neuropathy. Rationale: diabetic neuropathy is a common long-term complication of type 1 diabetes, resulting from nerve damage due to high blood sugar levels. Hypertension and asthma are not directly related. 50. What is the preferred method for self-monitoring blood glucose levels? A. Blood pressure monitor. B. Urine glucose testing. C. Finger-stick glucose testing. D. Chest X-ray. Answer: C. Finger-stick glucose testing. Rationale: the most reliable method for self-monitoring blood glucose levels is through finger-stick testing. Urine glucose testing is less accurate, and blood pressure monitors and chest X-rays are unrelated.